introduced, this is cerebral angiography, which was introduced in 1930s and which created really a flutter in neurosurgery. And all diagnostic purposes were, whether there is a tumor, whether there is hydrocephalus, were done on the basis of this investigation. Although it was possible, and although it was, neurosurgery was surviving and was thriving, and advanced neurosurgery was done, but it was, quite presumptive. And exact diagnosis was difficult, if not impossible. This was the investigation myelogram for spinal cord, and you introduced myodil dye in the spinal cord by lumbar puncture, and then move the patient up and down to move this dye and then diagnose. You see here there is a disc herniation, and this was also one investigation which was good and which really worked well for neurosurgeons for several years. But it was difficult, and it was, sometimes many lesions were missed and many lesions were misdiagnosed. So this was an investigation which also lived its life for good 50, 60 years. Then came the era of CT scan and MRI, and when even then, we were doing CT myelography and CT investigations based on CT scan were good, and they completely, as you know, completely revolutionized the field of neurosurgery. I joined neurosurgery in 1982 when there was no CT scan in Mumbai. CT scan was introduced in the world in 1976, 1977. In Mumbai, it came in 1982 after I joined neurosurgery. So neurosurgery was not a discipline. Neurosurgery was a hated branch of surgery because the diagnosis was not there, because investigations were very primitive, and the results of surgery were not good at all. So with the introduction of CT scan, with the introduction of MRI, the real neurosurgery began, and real neurosurgery has evolved and absolutely now is one of the most fascinating branches of surgery. This is ventriculography, which was introduced early in last century, and this investigation also lived its life for 70, 80, 90 years. And this was good diagnosis, but it was a difficult, and many cases were missed. Intraparenchymal lesions were missed on several occasions. Although neurosurgery was conducted, but if the lesion was here, the surgery was done on the other side, and on the it was difficult. This is pneumoencephalography, which was also a big investigation, and in our department we have a machine. We had a machine where the patient was tied to the table and the patient was moved up and down after the air was introduced. So it was a cumbersome method for the patient and impossible to diagnose for the doctor. So these were the investigations, and these have changed with the introduction of CT scan. You see the brain is seen, the ventricle is seen, and if there is a tumor, it can be seen clearly. And then, of course, MRI was introduced into the world of neurosurgery, and there has been a world of change in the investigative modalities which are used in neurosurgery. And then you can imagine the beauty of these investigations. This is CT angiogram, this is arteriovenous malformation, and it was so critical to, if you have to treat, otherwise it is impossible to treat. It is not impossible, it is completely not possible to treat unless and until you have very, very fantastic investigation. So this CT angiogram, and you see the CT angiogram showing the exact situation. This is the CT angiography, this is MR angiography, and you can see the beauty of the vessels lying inside the ventricle, and these things were very difficult, if not impossible, to diagnose. So this was the first model that we made, 3D model of the angiogram. You see, this is the angiogram, this is the 3D model. Although it shows, it exactly delineates where the vessels are and how the vessels are going in this AVM, but it is not such high quality or such great quality. This is DTI, fiber tracks, which is another beautiful modality of investigation in MRI. And you can see this is the AVM, and these are the fiber tracks around the AVM. This was the next generation of a model that we made. You see, this is the model, this is the AVM, and you can hold the model in the hand, you can take the model in the operation theater, and you can see the vessels going in the AVM. These operations are almost impossible neurosurgical operations. So you can see this model being held in the hand and taken. This, of course, is a good model, and it gives a lot of additional information, but the models then subsequently improved. You will be surprised that we from India were the first one in the world to introduce 3D models in the study of arteriovenous malformations of the brain. And it is, usually we talk of technologies, that technology is from the West and we are this is the, normal kind of talk going on. But here we introduce first 3D models of AV malformation in the world. So this is the arteriovenous malformation, and this is the, our subsequent model of 3D model. And you can imagine, you can exactly delineate from where the vessels are going and where this model and where the vessel is draining on which surface. You can operate on this also, but this gives you much more information. You can hold the model in the hand and you can mark the surgical flap. These are very critical issues in neurosurgery where exact point of the head is important, and then you remove the AV malformation. This is another AVM. You see how the model is showing the vessels, and the surface vessels on the skull are seen so beautifully. This lady comes with an AVM. You see, this is the large arteriovenous malformation with severe headache. These kind of lesions are impossible to treat in the world of neurosurgery. So we treated this with intraoperative image, with intraoperative angiography. And you see, this is the model, 3D model. And these models we are making on a regular basis. And you can give actually this beautiful smile on the patient's face, and the AVM is completely resected, and this girl is entirely cured. I have no hesitation to say that this model has been of great help. This is another AVM which is in a critical area of the brain, and this is the model that we made. According to the model, there are various kinds of information that we could get, and we remove this AVM. So this AVM surgery has evolved in the era of CT scan and MRI and angiography, digital subtraction angiography, but these models have really revolutionized. So this is the AVM. Now you see here, we made a model. So this is the model, and then we can mark the location on the head, and then we can design the surgery, and you can give a beautiful, you can resect this. These are difficult operations, and on the basis of this model, we designed an alternative approach from the contralateral side. So this is the AVM on this side. We approached the AVM from the contralateral side. So this was quite a beautiful operative strategy. So this is the AVM. This is CT angiogram. This is CT angiogram. This is digital subtraction angiography. And now you see the beauty of this 3D model. So this 3D model is our next stage. You can see exactly where the vessels are coming. You can hold the model in your hand. You can take it in the operation theater. You can continuously, this is life size as good as the patient size. And you can hold the model in your hand and then ultimately resect this AVM and give new life to the person. This is another AVM. Is a good angiography, can be good, but model gives you much better information. So this is the 3D model that we made, and we made a beautiful surgical resection on this difficult case. And this is the arteriovenous malformation, which is quite an impossible surgical, and this is post-operative result. So this is the model, and this is the AVM. and you can imagine it gives wonderful new information which was not available on regular investigation. This is another model, and now I will give you the 3D, how it helps in reconstruction. So this is the skull, and we have how to reconstruct following injury. If there is an injury to the head, you can use MRI, you can use CT scan, but this is the 3D model, and you see how beautifully it shows the holes in the skull from where there is a CSF leakage. So this is a patient with CSF leakage. You can find the CSF from the brain is coming into the nose, and this is a dangerous and life-threatening situation. At this time, we need all kinds of investigations. We did these kind of 3D models, and you see, this is another patient. Information can be acquired from the CT scan, but these 3D models give you exact delineation of the fracture line, holes in the base of the skull, and you can treat accordingly. So there is no question to have this kind of information in the operation theater is absolutely critical. Other thing that where we use model on a regular basis, and we describe for the first time in the literature in 2016 use of 3D models in craniovertebral junction surgery, where our work is amongst the best in the world without any doubt. So these 3D models can be made with special technology, which the radiologist and Shibu John will be expert in this. So this is the case, and we have to do this kind of instrumentation. This is we describe this technique, and we have created a revolution in the field of this craniovertebral junction. But to get information as to, you see this artery, vertebral artery, to identify the location of vertebral artery, and then to do instrumentation is absolutely critical in these cases. So this 3D model gives you that kind of information as to where to put the screw and where to do this C1 screw and how to avoid this vertebral artery. These are very, very critical information required in the surgery, and these 3D models, believe me, I am doing this kind of surgery for last 30 years. And this kind of C1, C2 screw fixation is not easy, but the information that you can get from 3D models is absolutely fantastic. And this 3D model information can result in giving a new life to this patient. You can imagine this beautiful 3D model. This is the artery, and we have to protect the artery. It gives exact information about the location of artery, and then you can do your surgery. You can see this another 3D model that we have made, and I'm not sure how many of the audience is neurosurgeons, but those who can in neurosurgery will realize the absolute criticality of this understanding, which no other investigation can give. So these are the 3D models which we take in the operation theater, and these 3D models are used now on a regular basis. You see this patient having a very critical anomaly in the craniovertebral junction. It is impossible to treat this patient unless you have a very good anatomical delineation. So this is the 3D model that we made on this, and we gave this person an absolute wonderful smile. Smile is apart, but we gave him hands and we gave him legs and a new life and a new vision for his life. So the advantage of 3D models is that you can hold the model in your hand and work in various positions during surgery. Surgery can be rehearsed. The model is actual patient size. It shows accurately the location and orientation of the facets. The size of the artery can be understood, and the deformities of head can be understood. So these models provide clear feel of the altered anatomy in a three-dimensional perspective, which is absolutely critical for the neurosurgeon to operate. So this is a real-time information, real life-size information, and needless to say that this modern, ultra-modern modality of investigation, which we did first time in the world, is our crown on our head, and I convey this message to the audience, and I wish those who are in the field will develop this further and take our world of neurosurgery and world of investigation further ahead, and we can all stand tall in the world of investigations.
Doctor, for your very informative presentation. And this really encourages us in terms of understanding, the potential of technology like 3D printing. And it was very encouraging because I think the end clinicians coming up with intent to use technology and also ensuring that how it can benefit the clinicians going forward is a great idea, and that's the way forward. And I think it's been a privilege, Doctor, to have you on for this event and share your insights. And there are some of these wonderful use cases that you shared. I mean, so when did you start, Doctor? I mean, when was this was the year that you started the
We started using. Can you hear, Shibu? We started using about 6-7 years ago.
Okay. So
in 2004, 2005, I think.
Okay.
2015 and 2014 and 15.
Okay. So, Doctor, I will have the audience now. If there are any questions that they need to ask, they can, share their inputs on the discuss panel, and the sir will actually, answer those questions. So, if anybody, please, you can share your inputs on the discuss panel on the right hand side. With that, yeah.
Color models are really amazing.
You know what? There is a question from Mr. Ketan. And this color technology, I'm not sure how the technological and technical issues are. You are more expert and you are the master, and I'm sure Shibu is the master. But I wish that this technology develops in our country. How it is done and what are the various things and how is it processed, I'm not sure. But we have been initially, I worked with Bhavin Jhankaria, who is quite a master in this, and then I worked with basically with Bhavin, and he made for me. I don't know the exact technical details, Ketan.
Okay. Yes, I know Dr. Bhavin Jhankaria, sir. I mean, he's a radiologist and he's been very actively
yes
on this. More that I see that he's also been the imaging side much lately. But I think that's the beauty of this technology. There's a good combination of both the 3D printing and 3D imaging. Doctor, let me ask you a question. Is 3D imaging visualization also going to be a key for these diagnoses going forward?
Absolutely. If you want to do advanced neurosurgery, you have to do advanced investigation. The world of investigation has developed, and the world of investigation has developed to a very great extent, and 3D technology is the latest introduction. And I send you, Shibu, my best wishes, and I send you my greetings to you, and I hope your conference will be very successful. Thank you very much, Shibu, and best wishes to you. Bye-bye.
So one more question, sir. One more question. It's from Dr. Firdaus. I'm an oral maxillofacial surgeon and a radiologist. I would like to know your opinion regarding terminal
trigeminal neuralgia. I'm sure Firdaus, trigeminal neuralgia surgery also, if you can get exactly the artery and nerve relationship on the basis of 3D 3D models, it will be a great investigation. This investigation, there is no real investigation for trigeminal neuralgia at present. and these are presumptive. You see, MR angiography, CT angiography give you some information, but these models can be absolutely critical. I completely agree with you, completely.
Thank you so much, Dr. Firdaus, for your questions. And then I have one more question from Dr. Thirur. What is your opinion on procuring? Sorry.
Yeah, 3D printer should be procured. I think this, if not today, within few months, this will be procured in all major centers without any doubt, Thiru. When there was CT scan was born, only one center in Mumbai was working for 6-7 months, and suddenly there were some 30 or 40 centers, and now there are more than 200 CT scan centers in Mumbai. I am sure there will be in-house printing printers very soon in the world of neurosurgery and in various other branches of surgery.
Yeah, so I think also, Dr. Now we see that there are also hub models in terms of having these centers opening up soon. I mean, that's the future going forward for making things more convenient for doctors to make things faster and efficient. Yes. Yeah, I also have one more question, Doctor. I know you're in a hurry, but I will take two more questions and then we'll wind up, sir. There is, science and half a decade before I was struggling to educate. Now it was reached. Now it is reached a lot. Okay, so this is what Dr. Thurur has actually expressed. So that is what his expressions are. But yeah, if there are any questions other than this, please. We have a great opportunity to have a conversation with Dr. With this time, very limited time. So it's always a pleasure to have sessions like these with all the experts. The next session is also going to be interesting. Everybody is very taxed with time. But thank you so much, sir. And may I then, if there is any question, quickly, or then we wind up, because sir has to move. Yeah, thank you.
Thank you, Shibu. Actually, I have to leave urgently. Okay. So best wishes to you.
Sir, thank you. Thank you so much for your time. I appreciate it. Thank you. Bye-bye. So, gentlemen, I think it was a great session, and I'm sure there would have been a lot of learning in the aspects of how 3D printing technology is actually benefiting, various specialization, especially in neuro, that we would have got an idea. Now we will also move on to another session, which is also going to be a session which is going to be held in another room where you can actually visit. And the session is going to be conducted by Dr. Atul Goel, and he's a cardiologist. He's also a vascular surgeon in terms of his expertise. Also chairman of BLK Specialty Hospital. He has also done some great work using 3D printing. So I think it'd be interesting to know his side of the story. Yeah. So in the meantime, while he would join, we just checked with his office. He should be there in, say, next 5 to 6 minutes. People can actually go to the exhibition booths, connect with people, and get to know what's happening in 3D printing and 3D imaging. Thank you.